Hello and welcome to another episode of the FemiNinja Project, and thank you so much for being here. I have another fantastic and fascinating guest with me today. His name is Dr. Theodore Henderson. He is an MD, PhD, founder, CEO, and medical director of Neuro-Luminance, who brings decades of clinical experience in psychopharmacology, neurobiology, infrared light therapy, and neuroimaging to the treatment of brain disorders. Dr. Henderson and his team specialize in treating patients with depression, concussion, brain injury, PTSD, chronic fatigue syndrome, Parkinson's, Alzheimer's, and ADHD. He is also the author of the recently published book titled Brighter Days Ahead: Leaving Depression Behind Through Innovative New Treatments, which is an excellent and readable introduction to these concepts. Dr. Henderson, thank you so much for being here and welcome to the show.
Thank you so much for inviting me. It's a real pleasure to be here.
This, to me, is such a fascinating topic, and I think it brings so much hope to a lot of people who are suffering with conditions that previously have not been treatable. Is that about right?
Yeah, that's exactly right.
Mm-hmm. So tell us, how you got involved in all of this. I've read your background,
Mm,
and you have extensive education, experience. It's just a fascinating journey that you've been on. And then to open up this clinic that provides so much hope and healing for so many people where they previously had none.
mm. Well, it's a long story, but I'll try to keep it short.
We
Um,
love long stories.
oh, okay, that's good to hear. Um, at the core is that I very early in college, I read a book that changed my life, and it's A Structure of Scientific Revolutions.
Hmm.
And what it basically says is science only changes through the death of the old guard, through shifts that are sometimes cataclysmic and violent. Think of, you know, uh, a shift from, oh, the sun rotates around the earth to, no, it doesn't. People
Mhm.
died for that concept.
Mhm.
So that opened my mind to the idea that one, you have to think outside the box, and two, there are no boxes. And that was incredibly liberating for me. Now, fast forward to I'm now medical director at a neuroimaging facility. We're doing functional brain scans, we're called SPECT
Mhm.
scans. And I'm diagnosing patient after patient after patient with traumatic brain injury. And I sit down with them and go over their scan. And then I say, well, we've got no treatment for you. Sorry. And I hate that. I hate that. I want to heal people. This is my calling.
Mhm.
So a colleague approached me about a treatment he was working on, and he didn't quite fully under the science, but he was a great man, Dr. Larry Maurice. He's passed away now,
Mhm.
and he and I, started looking at the Harvard and top level research that was being done on animal models. Mice that had been given a traumatic brain injury that were treated with low power infrared light got better. Their
Mhm.
brains healed. You could see it. You could look at the anatomy and the brain healed.
Mhm.
And that was exciting. But the problem is our skulls are pretty thick. So to get light through the scalp and skull of a human is a tougher project.
Mhm.
So we went into the laboratory and literally figured out how much energy you needed to get through the scalp and skull of a human and 3 centimeters into the brain
Wow.
without hurting it, without burning it, without cooking it. Bad outcomes. And so we figured that out. We published that first paper in 2015, along with our first case series of patients that with traumatic brain injury who we had
Mhm.
treated. And that's sort of how it started. It was, again, having an open mind. My initial reaction to infrared light was, what? Infrared light? Are you kidding me? As a
Mhm.
treatment modality?
Mhm.
But then I read the science.
Mhm.
And I could talk more about what that science showed us if you're curious.
I am really curious, and we do talk a lot on the show about, neuroplasticity and the ability,
Mm,
of the brain to be able to change itself, blah, blah, blah. And we've had a few people talk about red light therapy in other instances, like
mhm,
healing muscle tissue or
mhm.
sports injuries. So I would love to hear more about the science.
Okay. All right. Well, as it happens, I did my postdoctoral research while I was in medical school and residency on neuroplasticity.
Mm-hmm.
And so I was already primed. I already had all the understanding of the players in the game. One of those players is brain-derived neurotrophic factor, or BDNF for short. BDNF is the driver of neuroplasticity in the adult brain. Now, one of the things that became clear in these animal studies of infrared light was it was turning on BDNF powerfully, very, very powerfully. Now, there's another thing that turns on BDNF in the brain, and that is ketamine. And a good part of my book is about ketamine as a model for
Mm-hmm.
how we can start to treat depression differently in the future.
Mm-hmm.
And since ketamine turns on BDNF, it's turning on neuroplasticity. And that's why it's such an effective antidepressant.
Wow. I had never heard of it before. Yeah, I heard it mentioned once or twice, just in casual conversation, although who has casual conversations about that? But I never really understood how it worked. So is this in our bodies already anyway, or is this something that?
BDNF is there,
Hmm.
but you have to be able to activate it.
Okay.
And, for ketamine, for example, it's activating it through a what's called an NMDA receptor. And since
Hmm.
you've talked about neuroplasticity, your audience already knows about NMDA receptors because
Hmm.
that's what drives neuroplasticity and learning and memory and
Hmm.
changing the narrative of a traumatic experience.
Hmm.
That's all driven by the NMDA receptor.
Hmm. So then when did it get to the point that you were actually using these techniques and this information on your patients?
Hmm. So we started treating patients in 2013 and published the first case series in
Hmm.
2015. Now, that case series was using a technique that we've advanced upon.
Hmm.
We've added an additional wavelength and more power in that wavelength. And but that original protocol still stands. In fact, we have a grant with Harvard to treat VA patients with
Oh.
traumatic brain injury.
Hmm.
And we'll see if the grant goes through.
Hmm.
And we'll see if the grant actually gets reviewed in the current situation.
Hmm.
But it's actually an exciting study because we're comparing that multi-watt infrared light treatment that we
Hmm.
do versus the low power infrared light that you can see on Amazon and
Hmm.
advertised on the web.
Hmm. So are you using then the same levels of of the infrared light or the same power um, on the same I need to rephrase this on the whole scope of the injuries and disorders that you work with?
Hmm. That's a very technical question.
It is.
Way to go.
Thank
Um,
you. Sometimes
so
I get lucky.
there you go. I actually have a 140 page procedure guideline, a
Wow.
manual that I have prepared. And so you're not going to treat traumatic brain injury in a child the same as you're going to treat in a geriatric patient as an
Hmm.
adult. And we have protocols for we've now developed protocols for long COVID, and
Hmm.
which are incredibly effective.
Hmm.
And out of that work on long COVID, we figured out, holy smokes, our patients with long COVID and ADHD, they get better and they don't have ADHD anymore. They don't need to take Vyvanse or Adderall or Ritalin anymore. It was wild. So
That's
that
pretty
was a
crazy.
serendipitous discovery.
Wow. Okay, so you are actually treating the brain.
Mhm.
But my understanding of like red light therapy, just for, let's just say, okay, maybe cosmetic reasons or,
Mhm.
injury, soft tissue injury, is that it works on the mitochondria and kind of
Correct.
powers it up. Is that how it works in the situation that you're talking about?
Again, a very sophisticated question. Wow.
Thank you.
I love this. So yeah, and I've got some images of this if you get curious.
Mhm,
The infrared light, if it can get through the scalp and skull and reach the
mhm,
cells,
mhm,
it activates the mitochondria because the mitochondria contain what's called the electron transport chain, which is what makes ATP the
mhm,
energy currency of the cell.
mhm.
That electron transport chain, some of those enzymes contain copper. And so just like iron contains hemoglobin contains iron, which allows it to carry oxygen,
Uh-huh.
the copper allows the electron transport chain to move electrons. Now, it also allows it to change a photon into an electron. And that is, the essence of that first step that produces more energy. But
Mhm,
mitochondria are really kind of cool little organelles.
mhm,
They used to be their own entity millions of years ago. They were their own animal.
mhm,
And they started hanging out inside this bigger single cell creature and said, hey, this is pretty cool. They protect me and they feed me. And I just had to do this little thing over here. But they still have their own genes. There's 111 genes in the mitochondria, and many of those
Wow.
genes program. Yeah, yeah. So if you want to know if you're related to Genghis Khan, the way to trace that is through the mitochondrial DNA.
Well, I have a funny feeling that a lot of us are related to Genghis Khan. Just a
Very
guess.
true. Very
Mhm,
true.
mhm,
The mitochondria then produce these signals
mhm,
that tell the chromosomes to turn on this gene or that gene. And
mhm,
so when you hit the mitochondria certain wavelengths of infrared light, they turn on these signals, and the signals tell the chromosomes to make BDNF and other growth factors and to make anti-inflammatory factors. And so if we go back to long COVID for a second, and all these people who are walking around with inflamed lungs and
mhm,
they can't breathe and they can't walk up the stairs, and I can think of a dozen, you know, celebrities who have talked about
mhm.
the fact I used to run 10 miles, now I can barely get up the stairs.
Oh,
And if you treat that inflammation directly, in other
mhm,
words, you treat the lungs,
mhm,
it goes away. It clears up. I have patients who went from not being able to go up a flight of stairs to they're back hiking in the Rocky Mountains here in
mhm,
Colorado.
mhm. Nice.
Yeah.
So I had a question about that. Oh, goodness. I think I lost my train of thought. Um, with the long COVID. Oh, yeah, the lungs,
Mm.
targeting the lungs. So how would you do that? Because, if you're treating, is it through treating the brain that then it can impact the lungs? Or are you going directly toward the
Mhm.
cardiopulmonary system? How does that
You
work?
directly treat the chest wall. Directly treat the
Wow.
chest wall. Yeah. Now, here's an interesting sidebar to all of this is I'm talking about treating it with multi-watt infrared light. This is light that will penetrate the skin and the chest wall and the ribs and get into the lungs.
Mm-hmm.
But there's a lot of folks who are buying up these low power devices that are half watt devices. Now, I don't say they don't do anything because I actually have shown that they do something,
Mm-hmm.
but I've shown that they do it indirectly.
Mm-hmm.
So in fact, I treated the forearm with infrared light and increased the brainwave activity in 10 subjects.
Wow.
And so it's indirect. And
Mm-hmm.
so you can get this, low power infrared light pad or device or wrap and
Mm-hmm.
stick it on your body anywhere. You can stick it on your thigh and it will help your lungs and it'll help your brain. It'll help your learning and memory. It'll
Mm-hmm.
help, but just a little tiny bit.
Mm-hmm.
And as soon as you stop, it goes away.
Oh.
And that's what all the low power device studies show. Yeah,
Mm-hmm.
it can help autism a little bit. It can help early dementia a little bit. It can help Parkinson's a little bit. It
Mm-hmm.
can help depression a little bit. But as soon as you stop, it goes away.
I'm still fascinated by those by the lungs. I'm a former respiratory therapist. That was my
Oh,
first career, so
okay.
I find that so fascinating. So, is it working targeting different organs, targeting the lungs just through the blood flow, the lymphatic flow, or is it just the mitochondria doing its thing and dancing all over the body?
Okay. Uh, So it depends on what we're talking about. If we're talking about the multi-watt infrared light, we are getting through skin and muscle and
Mm-hmm.
ribs and into the lung tissue.
Mm-hmm.
Half watt these low power devices, half a watt, it doesn't even get through skin. It gets 0.8 millimeters into skin.
Mm-hmm.
That's it.
Mm-hmm.
It's great for growing hair, but again, it turns on something in the skin. There's some protein or something in
Mm-hmm.
the skin, and that gets transmitted through the bloodstream. So
Mm-hmm.
you really have to be clear what modality you're talking about. Are you talking about
Mm-hmm.
low power or high power? Because it's two very different things. And this is where the field is all kind of gamished together.
Yeah. Yeah.
Back
Okay,
in
so
August, okay,
go
yeah,
ahead.
just so you say one thing. Back in August, I published an article in Frontiers in Neurology
Mm-hmm.
that sort of lays out this problem of low power versus high power. And
Mm-hmm.
it lays out what we need to do to solve the problem, to understand really what we're doing. So hopefully, the photobiomodulation community will start to pay attention to
Mm-hmm.
that and start to adapt that.
Mm-hmm.
Because my concern is that if we keep commingling things,
Mm-hmm.
we're going to somebody's going to start calling this charlatanism. And I don't
Mm-hmm.
want that
Mm-hmm.
because it's not.
Mm-hmm. Okay, let's go back in the time machine. Okay, let's
Okay.
go way back. You're a medical student, okay? You're in medical school. If somebody had come up to you and said, this technology is going to be available, and this is what you're going to be doing with it, and this is where you're going to be years down the road, what would you have said to them?
It depends on when you caught me in medical school. So I went to medical school to be a surgeon because
Okay.
I actually loved surgery. I loved
Mhm.
doing it. I loved watching it. And I just found I didn't like hanging with surgeons.
We
To all
won't
my
tell
surgeon
anybody that.
friends, sorry guys. But it was just not my lifestyle.
Mhm.
Um, but still, if somebody had approached me that at that early stage in medical school, I would have, laughed.
Mhm.
Again, the infrared light does what? It doesn't. No, it can't do that.
Mhm. Mhm.
And the research hadn't been done yet,
Mhm.
so there wasn't anything to back it up.
Mhm. Oh, okay. So now we know how it impacts long COVID, the
Hmm.
results with that. I'm fascinated. Well, first of all, I'm really fascinated about the fact that you can treat geriatric patients and get really good results with that, because that to me is really surprising.
Hmm.
Also, other things like PTSD,
Hmm.
which is
Yeah.
just so, I mean, PTSD is just something that seems like it is so ingrained in the mind, in the body, in the
Hmm.
spirit, pretty much in every
Hmm.
part of us when we have it.
Well, that's and Bessel van der Kolk talks about that. The body keeps the score,
Hmm.
and and I can attest. It's
Hmm.
really true.
Hmm.
So one of the things about PTSD to understand, and I talk about this in my book, is that depression and PTSD both cause shrinkage in the brain. The hippocampus gets smaller, the frontal cortex gets thinner, the the part of the frontal cortex right above our eyes, which is the
Uh-huh.
emotional part,
Uh-huh.
gets much, much smaller, like
Wow.
50% smaller. And that is a degenerative change, but fortunately it's reversible.
Hmm.
And that is, where, things like ketamine and multi-watt infrared light come in.
Hmm.
So, we have patients who have, the divorce attorneys have started to send us patients
Hmm.
because, you know, male or female, some of them are so traumatized that the idea of filling out the questionnaire for the child custody eval, they just like take one look at it, put it down, crawl into bed for 2 days, and I am
Oh,
not kidding. They're that traumatized.
yeah.
And I'm thinking of one person in particular, and she came in, she got treated, and by the end of it, she was up there advocating for herself in front of the judge. She
Nice.
got her power back. And I think that kind of talks about not just the physiological part of PTSD, but that
Hmm.
that emotional part and that spiritual part of
Hmm.
PTSD. I talk about this a little bit in the book, is that
Hmm.
I grew up in a pretty rough environment.
Mm-hmm.
We were literally on the edge of poverty, and someone came into our lives who was an extraordinarily abusive,
Mm.
narcissistic man.
Mm.
And so there were plenty of times when I wondered about why I was here in my
Yeah.
adolescence, as many adolescents do, but you add trauma onto that and it gets worse.
Mm-hmm.
And the path of my kind of recovery from all of that was in a major part of that was my work.
Mm-hmm.
So in medical school, I started a basically a foundation, and it was an organization that went into grade schools and
Mm-hmm.
taught kids about safe touch and unsafe touch. So we were the Child Abuse Prevention Task Force,
Mm-hmm.
and it spread to several other medical schools back in the 80s. And I ran
Wow.
that for 14 years, and we you know uh, taught um, over 50,000 kids in the St. Louis area.
Wow.
But that was recovery for me. That was healing for me.
Well, just being able to offer support and, teaching, I don't want to say counseling, but educating children in that way is so important. Do they still
Yeah.
have programs like that around? I mean, did you start something that kind of, you know,
It did for a while.
mhm,
It ran on. Louisiana was doing it with undergraduates for a while.
mhm,
To my knowledge, it sort of fizzled out. And
mm,
now I actually researched it recently here. We researched how much time was spent in the medical school curriculum on child sexual abuse,
mhm.
and it was at most 2 hours, and the mean was about 0.5 hours.
Oh,
And
geez.
it hasn't changed. It
Oh,
hasn't changed.
that's pretty sad,
Yeah,
I
yeah,
think.
yeah.
So, talk about one thing I'm really curious about, and I was wondering about this afternoon, thinking about our conversation, because you're talking about a lot of these brain disorders, the traumatic brain injury.
Mhm.
Let me see the other ones. I can't really remember.
Alzheimer's,
Um, oh, the
Parkinson's.
Parkinson's and Alzheimer's. To me,
Yeah.
that is just really fascinating.
Mhm. Mhm. Yeah.
And so, do you treat them? I mean, how soon do you see results when you're treating somebody with, just narrow it down to one or the other? It doesn't really matter.
Well, let's go with Parkinson's.
Okay.
Because Parkinson's, the reason people gets Parkinson's, it's now understood that the neurons that make dopamine in
Mm-hmm.
the substantia nigra, a little
Mm-hmm.
tiny part of our brain that supplies dopamine for our motor pathways,
Mm-hmm.
those cells have something wrong with them. They cannot repair themselves. So if you get a traumatic brain injury in a car accident, your chance of getting Parkinson's shoots up hundreds of fold. I mean, it's
Oh.
just it's a huge increased risk. The idiopathic Parkinson's is believed to come from a virus that comes up from our gut to our vagus nerves into our brain. So that's become sort of, the advancements that have been made over the past um, 2 decades.
Mm-hmm.
But what we're doing is, again, if you help those mitochondria work better and you help the neurons work better and you
Mm-hmm.
turn on the regenerative pathway that doesn't seem to get turned on properly in these cells, they seem to survive. And the proof is clinical at this point.
Mm-hmm.
I'll give you just one example. Brian, and he's on our website. If you get
Mm-hmm.
curious, you can listen to him talk about his own experience. But
Mm-hmm.
Brian got treated very early in what we were doing. I mean, because I was thinking, oh man, I got to do something for this guy. And as soon as we started treating patients, 2014, he was in there getting his first treatment.
Mm-hmm.
He was able to cut his doses of Cinemet, the Parkinson's medicine, in half.
Wow.
And they stayed that way because Parkinson's is sort of this steady increase over time.
Right.
You got
Right.
to increase the dose because there's a steady decline in neurons. And he was able to reduce his dose and kept it down for, 5 years. And then it started to creep up and he came
Mm-hmm.
in and got treated again, mostly because he was having cognitive problems.
Mm-hmm.
And, he noticed, wow, yeah, I can think a whole lot better now. And,
Wow.
he's still trucking along. And he said, I talked to him about a month ago, and he said to me, Doc, sometimes I don't remember that I have Parkinson's. And he's had it for, since 2011 when he was diagnosed. And he's
Wow.
he's still moving, and he's still dancing, and he's still cycling.
You're
Yeah.
kidding.
No, I'm not kidding.
Oh my goodness. What a gift that you're
Yeah.
giving people. I mean, that's just
Mhm.
amazing. And I can't get the image of the woman out of my head standing up, advocating for herself. And it's like, yeah, I mean,
Yeah,
to be able to give someone the tools to empower them to take charge of their life again.
exactly. She's the FemNinja.
Oh, she is. She is yep. It's all about the power, baby. Yep. So I'm really curious about how this might be used, or if it already is being used, in spinal cord injuries.
Oh, great question. Yeah. And ironically, I was asked to give a couple of talks in LA at the World Brain Mapping
Mhm.
Conference
Wow.
by the spinal cord division. And I said, guys, I don't have anything on spinal cord injury. And so thinking about spinal cord injury, it's a little bit different because
Hmm.
we're talking about the cabling here,
Right.
right? And so, can we do something for dorsal root ganglia injury? Yeah, we probably can. If the neurons are alive, we can help them recover.
Hmm.
But repairing the cabling, that's a whole nother thing. And, actually my PhD advisor, Mark Jacquin, shifted into spinal cord injury. And they've been looking at,
Hmm.
can we train the axons to regrow through a channel if we give them, a little tray of growth factors to follow?
Hmm.
I don't know where he's at on that, but
Hmm.
it's a tough problem because you have to fix the cable from the beginning to the end. You can't just patch them back together.
Yeah, and that's a pretty long cable that you're working
Exactly.
with. Yeah.
Hmm.
Okay.
And those
Well,
axons grow a millimeter a year,
oh
excuse
wow.
me, a day, millimeter a day, excuse me,
Oh my
millimeter a day.
gosh. So at what point did you opened your clinic? Was that in 2013?
Yeah.
And do people come? I mean, I'm sure you have a booming practice with the Colorado, Denver Front Range area, but do people come from all over the country to see you?
People do come from all over the country to see
Hmm.
us, and I wish it was a booming practice,
Oh, mhm.
because here's the problem. People don't get that light can be a treatment. That has not penetrated the American consciousness yet. I mean, think about it. Stem cell. We all know
Mhm.
what a stem cell is. We all know stem cell there. Oh, stem cells. Yeah, inject them in your hip. You get grow new cartilage. Cool.
Yeah,
Everybody knows that. 12 years ago, 15 years ago, nobody knew that.
right.
And that veil of um, just not having that in your consciousness, that light can be a therapy. That's that barrier I need to penetrate in order to help not just, folks in Colorado, but all over the country and frankly, all over the world. I mean, this
Right.
this is so powerful. It's just stunning to me sometimes.
Well, if you go back to the basics, and I'm going way back to the basics, I mean, sunlight, is a powerful healing mechanism. I mean, let there be light.
Hmm.
You even
Hmm.
know, like, okay, when, wintertime, everybody gets a little, seasonal affective disorder. We need
Hmm.
to be that it's life-giving.
Hmm. Exactly. Yes.
So,
Yeah.
well, I think it's going to change. I really think that it's pretty much mainstream, and I think it's going to actually be pretty quickly because, you know, because you're here
We
talking to me.
hope there you go. Exactly. And it is kind of at that point, inflection point that people
Yeah.
do know about this. I can't, start a conversation with someone in an elevator without them saying, "Oh yeah, I know about that,"
Hmm. Hmm. Yeah.
to some
Well, and
extent or another.
I think when people hear about it more and more and they're curious, yeah, I think you are like right at a tipping point where it's just going to be pretty much almost mainstream. That's just what I think. So,
That would be great.
Yeah.
To be able to help,
Yeah.
all these people who are, I mean, look at depression. We haven't
I
talked
know.
much about depression. I mean, you get your antidepressants and you take it every day and you're meh better. That's the best you get. I mean,
Mm-hmm.
and it's so disheartening to people. And they go to their doc and the doc says, okay, well, try this one. Well, why are we trying
Mm-hmm.
this one? I don't know. It might work
Yeah.
because there's no science to these antidepressant medications. I'm sorry. I'm
Mm-hmm.
really not an opponent, not a fan. In fact, a very
Mm-hmm.
strong opponent against the serotonin theory. It's been disproven.
Mm-hmm.
So, getting people to, I mean, I have patients who, either got ketamine or got infrared light, or if you want to put the two together, man, that is like synergistic heaven,
Mm-hmm. Mm-hmm.
um, who have been depressed their entire lives. And now they're living a life of joy on very minimal medications. I mean, 6, 7, 8, 10 years out. Yeah.
What is that like for them? Because I would imagine that they wouldn't even recognize the emotion of joy if they've been in a depressed state for most of their life.
Mhm. Yeah. Very true. Very true. And I think they have to discover it.
Yeah, but wow, I just had a vision of Elon Musk's rocket ship with the ketamine and the other ingredient. I can't remember what it was that you said, the combination of the two.
Oh, well, infrared light and
Oh,
ketamine, if you put the
yeah,
two together,
yeah,
it's like it's 1 + 1 = 3. It's
yeah.
amazing. It's very
Nice.
powerful.
Now, when did you decide to write a book? Because writing a book is really not for the faint of heart. But with everything else that you've done and all the articles that you've written, I would imagine that it was pretty easy for you.
Mm. So I wrote the book because I would get on the phone with a patient who was curious about ketamine, and
Hmm.
I would be teaching them the same thing over and over again. And so, like, I mean, it was always, well, depression's not what we think it is. And
Hmm.
neuroplasticity is important. And ketamine turns this on, or infrared light turns this on, depending on who I'm talking with. And, I realized, okay, I keep saying the same thing, and this stuff is important. And there are a lot of people out there saying the opposite thing. Oh, just take your Prozac or your Lexapro.
Hmm.
So the book did, in a way, write itself.
Hmm.
And then it sat around for about 2 years. I mean, I wrote
Hmm.
it during COVID. What better thing to do than write a book? Um, my wife and I would come up with dinners from different countries. And so we
Uh-huh.
toured the world during COVID gastronomically, and I wrote a book. But then I rewrote the book because the way I originally wrote it was pretty heavy on the science side, and I
Hmm.
also I also got I got all my anger and aggression about institutional psychiatry out. All of that didn't survive the cut because what's that going to accomplish?
Right.
So I think what came out really is a conversation
Hmm.
and filled with examples of patients who had success or patients who didn't have success. And we had to kind of find what the real answer was because,
Hmm.
ketamine doesn't work for everybody. Infrared
Hmm.
light works 93% of the time for
Hmm.
depression, but there's 7% that it doesn't work on. And it's like, okay, there's another problem then. You need to figure
Hmm.
that out.
Is that where you found the relationship between infection and depression, or am I just kind of extrapolating something that I'm making it up in my head?
Well, now we're getting to see how either eccentric or Renaissance I am. I actually stumbled into chronic fatigue syndrome again from this neuroimaging uh, um, pathway. I
Hmm.
was seeing patients who thought they'd had a stroke or thought they'd had a brain injury, and yet what their brain scan showed was this diffuse, patchy, toxic-looking injury, either toxic or infectious.
Wow.
And upon digging into their history, I kept getting the same story of, oh, yeah, I was doing well. And then I got sick with this really bad illness. And I was like in bed for, 3 weeks. And then I never kind of recovered. And then I just got progressively worse and I couldn't think. And I started making mistakes at my job, et cetera, et cetera. until they end up with chronic fatigue syndrome.
Mm.
And so, I've been working now 16, 17 years, I'm not sure how long, on chronic fatigue syndrome. And kind of you get, once you get into chronic fatigue syndrome, you get people who have fatigue. That's not a diagnosis, that's a symptom.
Hmm.
And so some of these people actually don't have chronic fatigue syndrome. They have Lyme disease or Bartonella or Babesia, all these tick-borne illnesses. And so, it's been humbling, and it's also, it makes me read. I get up every morning and I read a stack of research
Hmm.
articles and study this, these things that I don't understand. And
Hmm.
so, hopefully, that means I can help more patients. But it is a little schizophrenic to have this world that's focused on viruses over here, and this world that's focused on infrared light and neuroplasticity over here.
Hmm. I find it very entertaining to hear that word schizophrenic from a psychiatrist who's done all of these things and all of this work. So that did make me chuckle a little bit. So this is a crazy question, but I'm really curious because I did work in the medical field for quite a few years. So I'm wondering how the traditional medical system is embracing this technology.
Mm.
Was that diplomatic enough?
Oh, it was. Well,
Thank you.
but one of the harbingers and the leaders of this field was at Harvard.
Hmm.
And he created an entire clinic there and a research center.
Hmm.
And so a lot of the research on this modality is done at Harvard. Who's going to argue with that? So that helps a lot. But
Hmm.
still, I had a conversation with a neurologist the other day. It's like, what would it take for neurologists to start referring patients? I mean, they don't have anything to offer for traumatic brain injury.
Hmm.
And he said, it would take a double-blind, placebo-controlled clinical trial or three.
Hmm.
Not picking on okay, I'm picking on neurologists, but they are the stuffiest of the bunch. They really are stuffy. And you know, infrared light's being used now to treat dry eyes because the
Yeah, I've
little
had it
glands
done
that make
several
oil. You've
times.
had this done? Yeah.
Yes, I
Uh,
love
would,
it. I absolutely love it.
but that's accepted in ophthalmologists or surgeons, and they're pretty stuffy too. But
Hmm.
there they are using it. And so infrared light has its applications, and
Hmm.
frankly, they're using infrared lasers. They've been using them for years. That's what LASIK is.
Hmm. Yeah. Okay, so now since you mentioned neurologists,
Oh,
that brings me to another condition that we haven't talked about, and that would be MS.
hmm, fascinating. So there's a smattering of work in the MS world on viruses
Uh-huh.
that are causal. And I started treating a handful of MS patients with antivirals. Um, excuse me, and they more or less stabilized.
Hmm.
And it's still MS is this sort of progressive disease as well. And it's got this huge autoimmune component. But remember, it's only found in the temperate zones. If you're
Hmm.
plus or minus 20 degrees from the equator, you don't get MS.
Hmm.
That says there's some etiological, some causal factor
Right.
outside of immunity.
Hmm.
Now, the military did a very large study with tens of thousands of subjects, and they looked at if you had Epstein-Barr virus, if you're positive for it, then your chance of having MS went up dramatically.
Wow.
And so that has shifted the focus of the field more to we need to pay attention to the role of viruses in MS along with other
Hmm.
things. Now, the possibility of MS responding to infrared light has been explored a little bit, and I was working with a colleague to treat a patient, being very clear, look, MS is about a lesion to the cabling, not
Mm-hmm.
the neurons. So it's that same problem of can we help the cabling? And what happens in MS is the cells that provide the insulation to the cable, that make them work efficiently,
Mm-hmm.
those cells die. And so the
Mm-hmm.
insulation goes away.
Mm-hmm.
And so there's this, short circuit, if you will,
Mm-hmm.
in the cabling. And could, infrared light stimulate those cells to, the remaining cells, the cells around there, to divide and go back in and refill that spot?
Mm-hmm.
Open question. Same thing with stem cells. Can we get stem cells in there and
Mm-hmm.
properly, stimulate them, so that they change into oligodendroglial cells, those cells that provide the cabling?
Mm-hmm.
Great questions. We don't know the answers yet.
Mm-hmm. Okay, I'm really going out on a limb here.
Oh.
Okay, so because I have there's a guy in town, he's actually a business coach, and I know him pretty well. I've taken some of his workshops and stuff. He was diagnosed 36 years ago. He's my age, so he's diagnosed 36 years ago with MS.
Mhm.
And, they were like, okay, this is it. Go home, enjoy the rest of your life. You're going to be in a wheelchair and or dead within 10 years.
Mhm.
And he
Mhm.
says, well, but what can I do in the meantime? I'll do anything. And they said, just, put your affairs in order, get your affairs in order, and this is it. You're going to die. You have no, there's no option. So he was like, yeah, I don't know. I don't really like that choice. So he
Mhm.
started meditating, and he did it in a way that was really kind of crazy creative. Like he was trying to connect with his spirit animal, and finally it came to him in the form of a beaver. And he's like, beaver? I figured it'd be like a hawk or a wolf. And then he realized, oh, beavers build things. So he would meditate on this beaver that would be building, his myelin sheath and all that kind of stuff. And he thought, at one point, he thought, I'm feeling a little better. And of course, it's probably just, maybe, who knows, his imagination. And he thought, but if one beaver is helping, imagine what a team could do. So in his
Mhm.
imagination, he created this whole community of beavers, and they would work, 3 shifts: day shift, evening shift, night shift. And then he thought, well, if these beavers are working so hard for me, I need to do something for them. So he, in his imagination, built this incredible community with a library, a school, a hospital for the beavers and their families. It's just the strangest story ever. But when he went back 10 years later and they did another scan, he had less lesions. And so here
Mhm.
it is 36 years later, and he's still functioning and having a great life, has grandkids now. And so who's to say?
Exactly. The power of the mind is completely untapped at this point. We have no idea what our minds could do.
Mm-hmm. Mm-hmm.
Yeah.
Yep, the power of the mind, I tell you. And that guy had a very impressive imagination. So I thought that was great.
Mhm.
So, Dr. Henderson, tell us where people can find you. You have a fantastic website. It looks like it is full of great information. There are some wonderful testimonials and personal stories there. So, just share some of that information with the listeners. How can they connect with you, get a hold of you, buy your book, anything that you want to share with them?
Mhm. Sure.
I'd love it.
So the website's neuroluminance.com, but who can spell that? So it's healmybrain.info.
Okay.
Healmybrain.info. We'll take you right to it. And it pops up, if you've got some questions, it pops up and you can ask questions.
Mm-hmm.
It is also useful to look at TBI.care. So traumatic brain injury.care.
Mm-hmm.
That's our foundation,
Mm-hmm.
and the Neurolaser Foundation. And the foundation supports some of our research, and also it subsidizes the treatment for veterans and first responders.
Mm.
And we uh, have the highest respect for our veterans and first responders, and we want to help them out. We were featured in a documentary about first responders and their
Oh,
PTSD
nice.
not too long
Oh.
ago, called Residual, by the way.
Mm-hmm.
And my book is on Amazon, and feel free to leave a review. And any multi-millionaires out there who want to invest, just give me a call. And those who are interested in chronic fatigue, you can reach us through Neuro-Luminance, and I handle that through my private practice.
Okay. Now, the documentary you said was called Residual,
Residual, yeah, very
and
very well done.
Would I be able to find the link if I looked it up, or could you send it to me?
Yeah, I certainly can send it to you. Yeah,
Yes.
I'd be happy to. He's a fellow Coloradan.
Oh, okay,
Yeah.
great. Well, yeah, send it to me and I'll include that in the show notes because then that gives, more eyes on your practice, more eyes on your book, and
Mhm.
on the incredible, fabulous work that you're doing. I think it's a really exciting time.
It is indeed. I get very pumped up when I talk about this stuff.
I can tell, and we love that. Do you have any final pearls of wisdom or anything that you would like to share with the listeners before we sign off?
Mm. Today I don't.
Hmm. Okay.
It depends on the day. Today I don't. I think that, I would say that realizing that things can be better,
Mm.
and that, if you're stuck with, PTSD or depression, or, your stuffy neurologist says, oh, you have MS, go home, says, oh, you have Parkinson's, go home, or you
Hmm.
have traumatic brain injury, go home. Don't listen to them.
Hmm.
I guess I did have something to say,
Yes, you
you know.
did. And that was beautiful. So thank you so much for that. And thank you so much for being on the show. I really appreciate it. Great conversation, fantastic information. And I am so excited to kind of follow you along and see where this takes.
Well, thank you so much for having me.
Everybody, thank you so much for listening. This has been such a positive, uplifting episode. Please share this information with everybody you know, especially if you know somebody who's struggling with PTSD, depression, chronic fatigue, any of the maladies that we talked about today. And just let them know that there is hope and there is a way to heal and recover no matter what some of the air quotes here experts might tell you or tell them. There's always a way to heal. The body has an incredible capacity to heal itself as long as we give it the right environment. So check out Dr. Henderson's website, check out his book, and remember, you've got the power to heal. And that is the way of the FemiNinja.